Okay. Yeah, à l'orange, I guess.
Orange.
It's French.
À l'orange? Duck à l'orange?
Yes!
That is some good shit right there.
So and actually that's really funny because so you have to have your last name in a medical corporation.
Oh, that's kind of interesting.
And so I was like, I threw it in because that means like duck with a side of orange. So it's like a med spa with a side of like.
That's perfect.
Yeah.
And duck à l'orange is like the fancy.
I know.
Like the good stuff.
I know. I haven't actually tried. I need to like make it.
You haven't had it?
No.
We won't hold that against her.
Yeah.
It's hecka good. I don't know. Well, you're not from here, right? You moved?
No, yeah, I'm not from here. I'm from the Bay Area.
Okay, so you guys have like French restaurants out there, right?
Probably.
Oh, girl, okay.
I know. I don't even know if we did. I hadn't been to any, so.
Okay, we're gonna have to, for your birthday,
I know.
we're all gonna have to like come together and like get you to a French restaurant.
I know, and there's one in Reno.
Oh, there is?
Yeah, I don't remember the name of it, but.
Okay, is your husband French?
No. It's actually, I don't even know how it came. So, I guess like throughout, even nursing, people just say, L'Orange because I guess that's everybody else kind of knew that, and there were so many Lauras on. They were like, let's just go by Orange, and I was like, okay. So people just have always called me L'Orange.
Okay, all right. Well, for her birthday, everybody, we're pitching in, and we're sending her to a French restaurant so she can have duck à l'orange.
I know. I need to try it. I'm afraid if I like try to make it though, it'd be like, well, no comparison, so I don't know.
Yeah, it seems like a really difficult one. And I've never seen, do you have tissues anywhere? I don't know.
I do actually.
They're right over here. You guys, I have allergies this episode. Don't judge me.
Luckily, I've got tissues.
Thank you. Yeah, I never even see duck for sale anywhere.
I know.
So I don't know.
Except for when there's that like seasonal turducken.
Oh.
Yeah.
Have you ever had those?
I haven't had it.
I refuse.
No.
I refuse to try turducken. I think that's like
so weird. Like when you like stuff it and keep going layers down.
It's like a form of cannibalism.
Oh, it probably is actually.
I think it's good. And I'm not like super carnivorous.
Yeah.
So I don't know. It just sounds gross.
Yeah, we had the only reason I've actually heard of that is when we worked like Thanksgiving on like the nursing floor or something, there was always a physician who'd bring in turducken because she's like, thanks for working on the holiday. It was like a big thing. But I never actually tried it.
Who the hell says?
I know.
Thanks, here's a turducken.
It was so random, too.
And you know what? Bless her heart, though, because I heard those bad boys take like 24 hours to cook.
Yeah, I don't even know how she did it, actually. Like, we are perfectly fine with the candy drawer. Because those are like, you go to the store and you grab Jolly Ranchers and we're like, pretty content. So, but yeah, she brought a turducken every year.
Thanks.
Yeah.
That's so random. Okay, welcome back to this episode of A Girl Business Podcast. I have allergies. Sorry to all my germaphobes out there. I totally understand. What can you do? I'm here today with Laura à l'Orange, owner of à l'Orange Med Spa. And I saw on your website, it says combining science with self-care.
Yes.
Okay, so tell me, I know Laura because we go to the same gym together, and her bestie Katie was like, Laura's amazing, like #1 advocate. And I was like, okay, to have women that love you that much, I'm like, let's get her on the show for sure. So I don't know you anything outside of that. So
yeah.
Tell me from how it all started, from the very top.
Okay, so, you know, I'm going to go from the top. Like, when I was little, like, before even, like, memory, like, type things, where I was playing with my sister, my younger sister, and we were playing tag outside. Like, I grew up in the Bay Area, and we were at my papa's house, and she slipped, and she fell, and she got a really big gash on her head. Mm-hmm. So we had to go to the doctor to get, the emergency room to get stitches in. And I remember, again, these like brief memories, but I remember they were like picking pebbles out of her. And the doctor was like, hey, you want to come over and help me? I must have been like 5 or 6. And I was like, absolutely. Yes, I do. So I went over there and I got to like pick little pebbles out of my sister. I think it was a different time, the 80s. But
you were doing an operation, girl.
I was. I mean, we were irrigating, we were doing all the things, and I was like, I love the human body. Like, love it. So that's when I was like, I need to be in healthcare, something. And I've kind of just like gone with it since then.
Wow.
So I kind of followed that path of, got into my first degrees from Sac State, kinesiology, which is the study of movement. Mm-hmm. And then I went to nursing school. And then I kept going. I kind of took the longest possible route possible. And then got my nurse practitioner and then my doctorate. So
you have a doctorate?
I do.
So technically we have a doctor in the house.
We do, but I don't actually make there's physician doctors and I'm doctor of nursing practice, so they're
okay,
a shared knowledge base for sure. But yeah, different pathways, I guess.
Okay, so when you went to Sac State, so you got your bachelor's in kinesiology. At that point, were you thinking about being a physical therapist or anything? Because when I hear kinesiology, I think that's what physical therapists go for, right?
And 99% all went to physical therapy after. I'm the only kind of oddball that veered the other way. I did love physical therapy. I got to do a little bit of that within the clinical type rotations. Mm-hmm. But I just loved the idea, again, that original, I like the surgery, I like the, the blood in the guts or whatever.
Yeah.
So I kind of veered off a little other way.
Okay.
Yeah.
So you finished your kinesiology, and how long was that program for you?
So that was my 4-year undergrad.
Okay.
And so then after that, I actually did a 1-year accelerated bachelor in Nebraska.
Oh, wow.
Yeah, at Creighton.
Wow. So was it a special program that they had over there?
Yeah.
And what did that help you do? That accelerated getting your degree in medicine, or?
Yeah. So that actually, you had to have a bachelor's degree prior to entering that program.
Okay.
Within a different specialty, and then you get your 1-year Bachelor of Science in nursing.
Okay.
To become a registered nurse.
Okay. Because I know there's CNA, and then there's LVN,
Yes.
and then there's RN.
Yes.
So that got you to RN?
That got me to an RN.
Okay, and then what does that path look like after that?
So that can actually even be your entire path. I know amazing nurses, and they're either LVN, registered nurses, and their entire career is that too. I loved the idea again of assisting in surgery and doing other the best part about nursing is you can change your path anytime you want to. Mm-hmm. And that fits my personality really well, because I'm I want to do this and I want to do that too and I want to do that. So I got my nursing degree and I was working on a medical surgical floor. And then a buddy actually went to labor and delivery, and I was like, okay, I'll go over there too. So I did 5 years of labor and delivery. And then from there, I have this I need to always learn more. Mm-hmm. And so then I went to a 3-year master program.
Wow.
And then another 2 doctorate.
Oh my gosh.
So I took the long way around.
Okay. That's all right though.
Yeah.
Look at you now.
I know. I'm loving it.
That's
seriously
amazing.
loving it. So
you did you had your RN, you finished Nebraska, you had your RN, you went to labor and delivery for 5 years. Mm-hmm. And then getting that additional 3 years to become is it called Master's RN, or is there a different title after that part?
Yeah, so it's a Master's of Nursing, so that I guess the old term is called a nurse practitioner.
Okay.
I guess the more correct term is a APRN, which is an advanced practice registered nurse.
Okay, and this is all super interesting, by the way. So thank you for breaking all this down, because I know nothing about this field.
It's so fun. I say now I collect the alphabet, because so my as a nurse practitioner, then you get to specialize. There's pediatric nurse practitioners, neonatal. So I am an adult gerontology acute care nurse practitioner.
Oh wow!
I know there's so many letters for no reason.
Imagine all that on a name tag.
I know. So it's on the board at the hospital, and people are like, "What are you doing?"
Right. What does that do, babe?
Yeah, because it's all there.
Yeah. So when you got your master's, did that allow you to do things that you couldn't have done with a bachelor's?
Yes.
Okay.
So that completely kind of shifts the paradigm where so once I got my nurse practitioner, that gives you a little bit different, like you are allowed to like assess people and then give them diagnostics and then order things such as like imaging or if they need any medication or and then treat them. So it's essentially really its own baseline practice, which is really cool. I actually started right after that from labor and delivery. I went to women's cancer.
Oh wow.
Yeah, so gynecology, oncology, which is basically the waist down. So we didn't address breast cancer, but I was able to go. We did chemotherapy. We did the coolest part, I think, was surgery. Again, you know, if somebody has ovarian cancer or uterine cancer, I got to say like I cured cancer today. Like it was pretty.
Girl, you literally.
Cool.
You literally.
I know it was so cool.
Oh my gosh, your positive karma is probably like through the flipping roof, girl.
I love it. Like I love this.
You literally cured cancer.
It was so cool.
That's so amazing because, you know, I'm at the gym with you and you have no idea. Like, I'm literally, like, working out next to a girl that cured cancer. Like, that's, like, mind-blowing.
I was part of it.
Yeah.
Yes.
Still, that's awesome.
Yeah.
So, and you did that after you got your master's.
Yes.
Okay, and would you have been able to do it with just the bachelor's or you need your master's to do that kind of stuff?
You can. There's so many amazing pathways. So, as a registered nurse, you can get a first assist registered nurse, is a FRNA, and so they actually can do assisting in surgery as well. I was with a private practice in Reno, and they utilized us as the first assist, and then so we did 1 week of surgery, and then we did 1 week of clinic, like treating their chemotherapy and their seeing them in the office, and then we got 1 week off.
Oh, cool.
So it was a really cool like setup and the way that it worked, like the 2 on, 1 off. Mm-hmm. And we just kind of followed our group of patients along with us. So you got to like follow them all the way through.
Oh, wow.
Which is really cool. But you can do first assisting as a nurse too.
Okay. And then how long were you doing the oncology?
So I did that for 3 years.
Okay.
And then COVID hit.
Oh, goodness.
And of course they're still practicing, but that's when we moved over here. That was in 2020. We moved here to Plumas County.
Oh, okay. So did the hospital move or?
No, so we spent a decade in Reno.
Okay. And then what caused you to move out here? Just COVID or you just wanted like a change?
I think a little bit of both. My husband's family grew up here. Like they have a couple generations here. And the trees, like you can't get those in Nevada at all. The trees and the mountains and the area, and we have a small family, so we're like, this is where we want to like have the kids, raise them.
Yeah, the schooling system is so different here.
It is.
It's like old school. Like,
yes.
Yeah, it's not dictated. It doesn't seem as political, I guess.
Right.
Is what I'm trying to say.
Yeah, there's a lot of like you said, you can jump into it and be involved with the changes that actually happen in the schools and such.
Like it's more hands-on, probably because it's smaller.
Yeah.
Yeah, and we have all that drama going on with the school district right now, but altogether I still think it's better than...
Right, and I think that's at a state level too, where, you know, the hands are tied a bit with the community, so...
That's true, that's a good point.
That's true.
So you moved here, and then did you put in a transfer to another hospital, or what did that look like for you?
Yeah, so I was with the private practice in Reno, and then we moved over here, and actually an interesting kind of like linking the dots, right out of Sac State. My husband did fire here, so he did the hot shots here, and so I had a job at the hospital as a dental assistant.
Oh, cool.
For 1 year before I got into the nursing program. Mm-hmm. So I worked for the local hospital, Plumas District Hospital, as a dental assistant. And how long have you been in this community or like in Quincy?
So I'm from Sacramento.
Oh, cool.
Originally, and I bought a house in I think it was also 2020. Yeah, it was 2020 because I bought a house in Lake Almanor in 2020.
Oh, okay.
So Plumas County.
Yeah.
And then I moved to Quincy last June, so almost a year now.
Okay.
Yeah.
Very cool. So I worked at the general clinic. There's a few like older physicians. They've since moved on, but one of them was named Dr. Reed, and he was the dentist there. And every day he'd be like quizzing you, like, what is this? What is this artery? Or where is this nerve? What am I blocking? You doing these things, and he always tried to say, like, you sure you don't want to go to dental school? And I was like, no, I want to be a nurse. So that was in 2009. And then kind of full circle back when we moved back here in 2020, I got to go to the hospital and work then in the hospital setting.
Oh, cool.
So that was a cool, like, connection thing.
Yeah. And then what made you say, okay, I want to go on and get my doctorate?
That is a great question.
That's like no joke, girl.
I know.
Like the real deal.
So I guess I like to clarify things too. There is a PhD in nursing, and there's a Doctorate of Nursing Practice, which I guess is a little bit newer term.
Is it the EDU one? Or like the ED? Because I know there's a PhD, and then there's also like an ED. Mm-hmm. But I think that might be like for therapists and stuff.
Oh yeah, I think you're right. I don't think they are the same, but I could definitely be wrong on that one too. So the PhD is where like they actually like create the the hypothesis and all those things, and they do the clinical research, which would be amazing too. And they created the Doctor of Nursing Practice because there's so much literature and so many things out there, and they never get into practice. Mm-hmm. Like it's like, hey, we've got this, it works really great, exercise program or whatever it is, and they don't ever get utilized because it takes a lot to change the policy and then get it through legislation. And so the Doctor of Nursing Practice takes that and utilizes it to like shift the knob to use it.
So like real life applications.
Yes.
So these people are all like studying, like nerding out, for lack of a better term.
Yes, so true.
Like nerding out in the textbooks. Yeah. And then they're like, okay, we have all this. Can somebody actually do something with it?
Yeah.
And that's what your program was.
That's what my program.
Okay.
And so the reason I chose that kind of brings me to my fun side, like personal life. I'm trying to run a half marathon in every state.
Oh my gosh.
Yeah. So it's part of like, there's 50 states. 50 years of at least putting 3 months in of like training for it.
Yeah.
So it kind of brings me back when I, as many do, go off track or, I don't want to work out ever. And so then it kind of brings me back like, oh, you've got to do a half marathon this year. So I started a blog on that in 2019. And I've just kind of been writing about that since, but I wanted to get to the point where insurance pays for people to travel, because it really does like improve your mood, it improves like your gut microbiome, and it, like all of these different things. And so that's where I wanted to take the literature that's already out there that's proving these things, and then apply it by having insurance pay for people to do these cool things like run each state. And
that's amazing.
Yeah.
So and how long was that program? You're a doctor?
That was another 2 years.
So during those 2 years, you're pretty much collecting like, hey, I'm doing this in real life and here are my results?
Yeah.
That's awesome.
Yeah, it was a really cool, it showed a really huge return on investment for whoever, whether insurance or employer paid, just to keep them healthy.
Yeah. And when did you finish that program?
That was last year, so 2024.
Oh, well, congratulations.
Thank you.
You're a recent graduate.
I am, yes.
Girl, you gotta go have some dental
I do. That's so true.
Let's see if we can DoorDash you some.
I know. If you can find any place that DoorDash is here, that is what is needed in the community for sure.
Yeah, that's what we need.
Whoever's next, we need DoorDash.
We need a girl business DoorDash.
Yes, and we need some sort of like Thai food here or something.
Yes, like some pho, like some Vietnamese, some Thai.
Oh, so
I love
good.
all the Thai soup.
Isn't that like Korean, I think?
Oh yeah.
Mm-hmm.
Oh, the bibimbap where it's like the crispy rice.
Yes, so good.
We need some damn food.
I know, we do.
I'm starving.
So true.
I need Taco Bell.
Yes, and they used to have that here.
Oh, I know.
Oh.
I did a video about, I got shut down, right?
No!
Oh, girl, it got shut down because they were slinging drugs.
Oh, yes, I did hear that.
Yeah. So I was like, I'm gonna run for mayor. I'm bringing back Taco Bell.
Yep.
So
I mean, the quesadilla itself.
Mine's the bean burrito.
Oh,
That's
yep.
like Oh my god, that just hits right every time.
Yeah.
I've driven to Reno just for a beef burrito.
Oh my gosh, that's so funny.
I'm not too proud to admit that.
I tried to make the like sauce thing at home.
Oh, like the red sauce?
Yeah, or I don't even know what it was. It's like a mayonnaise mix or something.
Oh, I don't know. But let me know if you got any good copycat recipes. Like, I'm still working on
that. It's not the best.
Okay, so congratulations on graduating. So after you collected all that data, did you submit it somewhere, or what's the process after that?
Yeah, so that became part of my thesis or my project for that program, just to, again, I guess show, here's all the evidence that everybody has, worked out. And when you put it all together, this is why it would be such an applicable program. And then from there, propose it to employers or insurance, and nobody listens. Like, nobody will call me back, or nobody will, because it isn't an upfront investment for them, or an annual investment. And so that's where I'm kind of at a stagnant point in that project.
Yeah, it's just going to take the right person to
I think so.
To see it, because I think with medicine it's for one, it's very pharmaceutical driven.
Yes.
Like big pharma.
Yeah.
And sometimes we lose out on holistic healing and stuff, and things like, hey, traveling increases your mood and all the things that you're trying to show. But I think you're onto something big.
Yeah.
It'll work. So is it a dissertation? Is that the...
Yes.
Okay.
Yeah, it was.
Okay, and is that published anywhere? Like, if people wanted to read it?
It is. Well, my first one from the master's program is published, and I think PubMed. It's published in that, and then the project itself, although it was a very long written project, that one's not published.
Okay, and then what was your master's thesis on?
So that was actually on gym memberships being paid by insurance companies. So right? And they do that now.
That's awesome.
So that was, I went to University of Nevada, Reno, and so that one, there's a local insurance company, Hometown Health, and they utilize that program now too. So so they pay for people's gym memberships, which I think is like a growing thing too. Not that my paper was like the thing that changed it, but it was part of the
part of
the picture.
You've done so many amazing things.
Again, just side fun things, I guess.
Yeah, what do they call side quest?
Side quest. My husband is like, no more. And then I was like, we should do like a med spa. And he's like, oh my gosh.
So how did this all come about, the med spa?
Well, it's actually exactly what you said. So like you said, big pharma kind of drives everything. So I've been working at the hospital for 5 years now, and I prescribe medicine to help people lose weight or testosterone, and insurance is just like, no, we're not going to pay for it. And it takes it out of their hands. Like, they kind of lose their own advocacy for their own health. And most of the people, they're like, I go to the gym, I eat this, and I'm not sure what's going on. Like, I don't understand what's happening. So the med spa opening actually gives them the independence to purchase it without having to go through insurance.
Yeah.
So that's been like one of the aspects. And then the second part, like I do Botox and dermal fillers for a couple of reasons. Like, the largest organ of our body is our skin. And skin cancer is like so huge, like top of the list. And so, taking care of skin, I was like, let's do it. And a lot of people utilize these things already, but we have to drive to Reno or Chico. It's like an hour and a half drive for a 15-30-minute appointment, and then you go to Costco and you spend a heck of money at Costco, and the gas to get there, it's like a really expensive trip by the time you get home.
It's like $1,000.
It's so expensive. So, I was like, well, I've got certifications, I went back for that too, and so I was like, let's just do it at home.
That's amazing. And how long have you had this location, your med spa?
So I've had this will be going on a year.
Awesome.
Yeah.
So you've had like a lot of big exciting things recently happen.
Yeah.
That's amazing. And you said you had to get additional certification so what kind of schooling did you have to do to be able to do this med spa? So this is, I flew down to Los Angeles and got a certification for Botox and dermal fillers. Okay.
And that's just really going over, like, do you know your facial anatomy? Do you know where your nerves are? Where's the muscle pooling to actually relax that muscle a bit. And so then I got that in 2022, so 3 years ago.
Okay.
And so I've been practicing since then.
And when you went down to LA, was that just like a test that they did, like a day-long thing, like, hey, let's make sure you're not gonna, shoot anybody in the wrong place?
Yes, and they actually had people like come in, so we got to work on real-life models. And there was such a cool variety of healthcare providers in there, because actually a lot of individuals do this as kind of a side thing on top of what they already do. Like there was a dentist there, and they could do like injections in your jaw for if you have like that bite TMJ.
Oh, to like relax it.
Mm-hmm.
Oh shoot, I might have to get some of that.
You can do it for like the back of your neck for migraine headaches.
Oh wow, so you can do those here too then, the Botox because that's used a lot for migraines, right?
Yes, it is.
Okay.
The only difference with that one is the amount that you have to use to treat a migraine is a lot of units, and so that one is generally I recommend get covered by your neurologist, like through your insurance, because it would just be so expensive.
Yeah, it would
otherwise.
Be a lot.
So.
And then when you went down to LA, what education do you have to have before getting that certification?
So you have to be a registered or certified either nurse practitioner, physician, dentist, registered nurse. So you have to have that program and completion of the program before you can start that program.
Okay, so you have to have your master's then?
Or a registered nurse. Like you have to have.
Okay.
Yeah.
Okay, so you can be a registered nurse and then go down and do the
and
test.
The training, yeah.
Okay, and then be able to do the injections.
Yes, so you can still do the injections. You, as a registered nurse, you can do the injections, and they are great at doing those. You just wouldn't be able to order the pharmaceuticals, so like the actual product.
Okay, so how you would pretty much, well then you wouldn't be able to have your own place then essentially because you can't order it.
Right.
So you'd have to be working like under a doctor or somebody that is a nurse practitioner?
Yeah.
Oh, okay, we're learning lots of stuff today,
it's
guys.
really fun.
I'm like building a little tree in my mind.
I know, I'm so excited because I was thinking of like trying it out.
Maybe I'll like figure out how, I always say that I'll do all these fancy edits and I'm like,
and then it's, and you're like, and life happens, and then you're like, oh, did I make dinner?
Yeah, exactly, but you're making it really easy to like follow along.
Oh, good.
So thank you. Okay, so you can have your RN and then get the certification, but you wouldn't be able to be like independent per se.
Right.
Okay, got it. But to be independent, you can have your nurse practitioner.
You can. California is doing, again, this legislation. So in like 8 months, nurse practitioners can own their own practice. So I actually have a collaborating physician currently. And in Nevada, I still carry that license as well. So I'm able to be an independent practitioner there.
Okay.
So it's kind of half the states. We're kind of in the realm of change right now. So it's cool.
When you did your, when you got your doctorate, is that the right term? Did that allow you to do anything that you couldn't have done as a nurse practitioner?
It didn't per se.
Okay.
Actually, and it's such an interesting concept. I guess that the best like comparison would be it's my doctorate in like the academic world, or like Doctorate of Pharmacy, who I think are the most like underutilized. They are so smart. Are pharmacists and Doctor of Physical Therapy and. But then you don't necessarily like call them like, hey, Doctor of Physical Therapy, like in the office or such. So I still go by Laura, on all those aspects of it.
So it's pretty much like an extra stamp of approval. Like, hey, like I'm super educated. Like I know what I'm talking about.
Yeah.
Well, that has to be like a really good feeling, though, right?
Yeah, it's pretty fun.
Good for you.
To be both worlds.
Yeah, and then you said that you wanted to do this to give people an opportunity to have more control over their health.
Yes.
Okay, so how's that journey been going?
Oh my gosh, so fun. Like I'm like super excited because again, it's just we've kind of been turned down over and over. Like I'll take testosterone for an example. So there's an average reference range of testosterone. So you have total testosterone 300 to 1,000. That's a huge therapeutic window.
Yeah.
So you have the individuals at 1,000. Those are like your 20-year-old men and right, and actually that's definitely the first thing that we think about. But like testosterone, mental clarity, and improved sleep, less insomnia.
Oh really?
Yeah.
I would have never thought that.
Their energy levels, so like just being able to keep up with like their kids, their work schedule, their all these different things. Libido is of course one of them, and then physical, like muscles is another aspect of that too. But it's usually those first three that people are like, okay, I'm ready to feel well again. And so then you have those men who are at like 300 and they're just trying to get out of bed to do the day and trying to do these different things. And so if you can optimize where they're at, get them to 800, 700 even, they're like night and day, feel better.
Yeah.
But insurance won't cover it until you're like 200. 250 and something.
Wow. That seems very unreasonable.
It is.
Because if it's a range, if you're at the low end of the range, you're going to feel low.
Yes.
Obviously, who wants to feel low?
Yeah.
So insurance companies pretty much waiting for people to be absolutely miserable before they step in.
Which drives you right back, like you had mentioned. So like obesity. You have to, for these medications, they're kind of big on the market right now.
Yeah, Ozempic and stuff.
Ozempic, Mounjaro, Wegovy. So those, you have to hit a certain body mass index to get those through insurance. So you have individuals and they're gaining weight so they can get on this medication so that they can lose weight.
Right.
It's just so bad for like the yo-yoing of the body.
Yeah, exactly. And then you're trapped right back into that yo-yo diet.
Yourself. And then and then your blood sugar is high and your insulin resistance is higher, and so you have these individuals who are like in this kind of like, you know, trapped scenario where they're like, do I gain more weight or do I hang out in this like overweight category?
Like the uncomfortable gray area.
Or again, like energy and like all these different things.
That has to have been so frustrating, like to see your patients and for you to have to be the one to say, hey, I'm sorry, like your insurance said no.
Right. It gets to the point where like you're in there and you like talk with them and they're like, okay, so I do this for exercise, I do this for diet, and you know, those are kind of the big, but like what's your stress level? What's your water intake? What's your sleep schedule, like, you know, all these different things. And then it's like, yeah, you're a great candidate, like we should definitely start you. And then you prescribe the medicine and insurance wouldn't pay for it. And I know, and so it's like, why am I even prescribing it? Like insurance tell me what to write for. Like if you're just gonna make us a middleman.
God, how frustrating.
I know.
So and this must be like really empowering then.
It is, especially for like, I get to watch people become their best self.
Yeah.
So they get to like, usually they're ready. They're like, I'd like to, you know, take the skincare route, or I'd like to start testosterone, and then, you know, actually it works really fast, but, you know, within 3 months, and they're like, I am doing this, I'm doing that. And it's like, that is so cool.
Yeah, that's amazing.
Yeah.
So for when you have, because you work at the hospital, right?
I do, yeah.
So did you have to do anything special or like go through the hospital to say, hey, if their insurance denies it, can I pick them up as a client? Or like, how does that work?
No, so I actually did have an individual over there, and through insurance, they approved it, which was great. But our copay was $1,592 a month for like Ozempic. And I was like, girl, what are you doing on the side? Like, where are you getting that money from?
Right.
and so it didn't make sense. And so there's also different routes again. So this is independent of that. I work at both, and we're able to get it for $3.99. So it's just like, it takes that burden off of them a bit. So if I can get it through insurance, I'm gonna get it for them for insurance. Like whatever way they can get it and, you know, be their best selves. And if I can't get it through insurance, then it's like, well, there's another avenue. It doesn't even have to be with me. Like, you know, you can go through any, it's just hard with that border of Nevada or Reno, and then California receiving the medicine. I never would like mention myself or, you know, recommend myself. I mean, I'd recommend myself, but there is that boundary of, you know, I let them know that they can get it through an alternative, but I never have mentioned my med spa personally, because that would be conflicts and...
So you wouldn't be allowed to do that, like, in the hospital?
But usually I'll just say, like, look for any sort of, like, online or med spa, and imagine if they, like, look, they'll be like, wait a minute.
Right.
But, yes, I don't ever say, like, hey, guess what I could do on the side for you?
Yeah.
Yeah, that's it. It would feel just like corrupt.
Yeah, like a little
like yucky.
Yeah.
By the way, here's my side card.
Insurance declined it.
Right? No. That would be so yuck.
But I mean, you're still like really hands-on, and you see
yes.
the need for it,
and that's a big thing. I saw the need for it, and again, people are going to go down to Chico to get it, and so I was like, well, why do they have to go that far?
Yeah. Have you ever thought about doing PRP injections?
Yeah.
That's what I need, girl.
I know. Oh,
I need it.
So good.
I really need. Like my hair started. It was probably like 6 years ago. It was just falling out like in clumps. And it's getting a little better now. I got some stuff from Charisse over at
cool.
Apothecary.
Yeah.
And so I've been using that, and it's getting better. But I'm like, oh, if I can get some because I'm too lazy. I'm not driving to Chico.
Right.
For that. Sorry.
Yeah.
I'm not. But yeah, if you ever get PRP injections.
I know. There's so many like great, and I think we're at again like this generation where we're tired of them. Big pharma, big food, like dictating us.
Right. Some 75-year-old man sitting on the board of Blue Shield, like, kick rocks, babe. Like,
right.
No, I'm tired of it.
Who's never experienced any sort of like, that's the whole also like evolving and really expanding world of perimenopause and treatment and menopause and treatment because you spend a third of our lives, like we're living longer.
Yeah.
And it's just not a very well-researched category yet. We kind of spend all of the money on pregnancy research, and so now that's kind of becoming a booming spot.
Do you have any? My mom. Sorry, not to put you on blast, Mom, but my mom's on menopause.
Right.
Do you have like anything that you recently learned that you could share about menopause, or
yes?
Let us know. Let the people know.
Oh, I just get so excited about these things. So the average age a woman goes through menopause, again, average is 52.
Which is young, if you think about it.
It's really young.
That's actually really young.
And that's the average. So, like, I'm currently in, like, perimenopausal, and my mom went through menopause at 38. So,
wow.
I know. So
do you think that's normal, or do you think that's, like, our stuff that's in our food, or?
That's a great question. I think it's a combination, and I don't think that's normal.
That's young, girl.
So young.
Okay, sorry, not to cut you off. Okay,
no, so you start perimenopause 7 to 10 years prior going postmenopausal. And postmenopausal is kind of such an interesting term because that qualifies as 12 consecutive months of having no menstrual cycle. But the amount of individuals who've had a total hysterectomy, whether it be for abnormal uterine bleeding, for fibroids, or there's so many different reasons why you can have a hysterectomy. But now if you don't have a uterus, right, you're not menstruating. So how do you determine when they go through menopause? And so then they're kind of at a loss, like, well, I don't know if I'm ovulating this month because I don't actually have, they have symptoms, but they don't necessarily have a flow. So when you think about the average age, 42 or 52, 10 years prior, that's around age 42 or so that now you're transitioning for the next 10 years. And it's not necessarily what we used to think of like, oh, you kind of worked your way down with estrogen. No, it is like you're having palpitations of your heart and then some hair loss. And then your mood is like, wow, I'm really like going off on my family and I know I'm out of like control. Like I'm a bitch right now. And I don't even care. I can't control it. Like,
fuck you guys.
Yes, it's so like, and there's all these different symptoms that we've just like thrown in like, oh, you should be on an antidepressant. Or you should be on...
Oh, and that's because Big Pharma gets a kickback from that.
It's so true. And they're like, oh, you're fine. Your heart's been racing. We've done an EKG. It's normal. And it's like they're struggling. The night sweats, the hot flashes, it was miserable.
Oh.
And so we've never really... we used to do, a few decades ago, give everybody hormone replacement therapy. And then there was this one, like, pivotal study that said it increased the risk of breast cancer. And then it was really abruptly stopped. You had this whole few decades of not treating it with that at all and treating more of the symptoms. So you would treat a hot flash or you would treat depression that you get or palpitations with a different medicine. And again, it's not really getting back to what is the cause of what's causing these. And so now, and I mean now, like this literature is currently changing. there's, all these books, like there's one called The New Menopause, and it's, written by a OBGYN who just like, there's so much more research to say like we should be utilizing hormones more. And again, it just goes back to the testosterone too. Like, and again, now we're kind of balancing when should we stop those, because we're living well into our 70s, 80s, 90s.
Yeah.
And, with each decade, let's keep the longevity better as opposed to, just living for the years, but living so that you can quality, like you can pick up your grandchild.
Yeah. Like, let's actually live, not just, we're dying. It's taking us longer to die.
Right.
Yeah.
Yeah.
And it's like, with the way that medicine currently is, it's like the answer to everything, here's Prozac.
Yes, which was a great medicine.
Right.
I definitely believe in like the mix of whatever works for you. Like, I can see myself very commonly, like, because I get really fired up on, like you mentioned, like big pharma, big food, and how they are a business, and so they profit over people's suffering.
The FDA,
yes,
all that.
All of them.
The food industry, that BS food pyramid.
Yes. Oh my gosh.
Girl, not us getting banned from YouTube for spilling the facts.
I know. Well, they're true, and I think again everybody's like coming to realize all these things. But I think I get into that really like tough, and so it's sometimes reminds me like there are great medicine in Western. Like we have a great options. Mm-hmm. So use acupuncture and Prozac.
Yeah.
Use all these different avenues.
Yeah, like utilize it, but don't rely on it.
Right.
Like, yeah, no, I'm totally with you, because I am grateful for Western medicine. You know, like I landed in the hospital once, and I was super glad to have the emergency room right there.
Yeah.
But I also don't think it should be used for everything. Like you said, find a balanced approach.
Yeah.
So, okay, so you did all this amazing, you did this research, and you did years in the hospital. You're still working at the hospital.
Yeah.
How was the transition from working in hospital to, okay, now you're a boss girly, you own your own business? What was that transition and learning curve like?
Oh, I think it's huge, and you can, definitely speak to this for sure. I'm very experienced in the injections and like the medicine, how those work. Business is its own beast. It's like, again, like, so for medicine, you have to have a professional medical corporation. So I have to open a corporation. And so, and then along with that, all your tax filings, and then there's, I know, and then you have to do all of these, like you have to make sure that everything works with the medical board on all the things. I don't even know, like everything. There's so many, and as soon as you're like, I think I kind of know what's going on, and then like we talked about, like then you have to throw in social media, or advertising is its own world too.
Right.
And I have not gotten that, so it's so far just kind of word of mouth. Who needs it for access, but there's just so many more things where I would love to just like come in and like make people happy with what they're getting, and then like I'll see you next time. But there's so much more on the charting and all these different things.
And spreadsheets and numbers
and numbers, finances. Oh my gosh, there's so many different aspects of business, which is really cool to learn, but while you're like in it, you're like, couldn't I just know this all right now?
Yes, exactly. And it's like, okay, I didn't go to school for business. Right. I went to school to be a nurse.
Yes.
Like, yeah, and it's expensive too. It's like
so expensive.
So how long did it take you from, okay, I want to go into my own practice. Yeah. How long did it take you to get everything approved and all the paperwork and stuff until keys for the door? How long do you think that took?
Gosh. It takes like probably at least a year.
Oh, really?
Because you have to go through all of these boards. First, you have to file the professional corporation, and then after you do that, you of course have to make sure you have medical malpractice, and then business malpractice, like liability or general liability, and then for the place that you're managing, and then you have to apply for all the pharmaceutical companies, so you can actually get the medicine that you're giving these clients. And then there's just so many different steps, and they all take their 6 to 8 weeks to give you your, like, okay, now you're official. Yeah. Move forward to the next. So
a whole year. I
would say probably, just because at the same time I am very happily working at the hospital too. So I suppose if I had gung ho, like this is gonna be all I do, then maybe it would have taken less time.
Well, a year, I mean, that's not even bad considering everything you have to do.
Right.
Like, it takes, that's a long process on their part, not even on your part.
Yeah.
So, wow. It's really in depth. I mean, I guess,
it is.
You are dealing with people's livelihood, so it makes sense.
Yeah.
Was there any point in time where you were so frustrated and you thought, okay, maybe I shouldn't do this?
Yes, all the time. Seriously, all the time, because it is, I think I recognize more so, those who have established businesses, like the hospital or Safeway or whatever it is, they have so much work they do that is, I didn't recognize before, and I didn't, where it's, again, I just wanted to help, with their skincare, and it's just so many, stops and red flags and fees that, you get to the point, it's not a profitable thing right now. It's just here for
funsies.
For funsies. And so my husband is how much are we gonna, I work this job to pay for this one, which is the reality of business.
Yeah.
I mean, you had mentioned it earlier, your January, just, looking at your equipment and stuff.
Yeah, I'm in the red for sure,
yes.
Until my busy season hits.
Yeah.
So, I think any woman business owner, we do it because we love it.
Right.
We love what we're doing.
Yeah.
Otherwise, it would just be a no. So when we're at those moments where you're like, oh my God, does this even make sense? Should I keep going? What do you think kept you moving forward with it?
I think a large part of it was I can't take it back now. once you've opened a corporation, you can't just reel it back in.
Right.
And then you still, even the medicine that, I have here, all the skincare things, those are really, really expensive. That's what people pay for. Mm-hmm. And I can't just return them.
Right.
It's something where, when they come in, they're just paying for the product itself. And so that's where, I can't go back.
Yeah.
I'm all in at this point.
But you've had a year under your belt now. Mm-hmm. And the year, the first one, they always say that's your rockiest year.
Yes.
So you're coming into your second year now. What are some things that you look forward to, or any exciting news or anything with the business that you want to share?
I think so. I'm, again, I think it's so amazing to be in this small town, this rural community. And I thought I grew up in a small town where most of the people there, and it's a small graduating class, but it's nothing like here.
Mm-hmm.
And people genuinely, they want to be here. I think they're really happy, and you go to Safeway and you see the people you get to work with. That's so cool.
Yeah.
And hey, what are you making for dinner tonight? Oh, that's a good idea. I'll probably make it too.
Yeah.
So that kind of helps along. But I think just getting people in so that they know they don't have to go so far. And I would love to offer laser hair removal, laser resurfacing. Again, that has its own equipment that is, really expensive.
Yeah.
But I would love to have that home.
Mm-hmm. That's amazing.
Or cryotherapy. There's so many different things that we can offer.
It's exciting.
I know.
So exciting.
One day, maybe.
What's your favorite product that you offer here? What's one service where you're I think almost everyone can benefit from this?
100% the skincare.
Yeah.
100%.
Well, tell us about your skincare. What kind of stuff do you have?
You
want to show us anything?
Sure. One that I actually love the most is called Glow Biotics. And they utilize your microbiome, your skin microbiome, because we of course have tons of bacteria and parasites and viruses all exposed to us at all times. And so it's not just a topical treatment, it actually it improves the...
Careful. Don't try.
I know.
Don't want you
to move this thing over here too. So I guess if I could say 3 essentials that you're utilizing for skincare would be a really good cleanser, like double cleanse, vitamin C, or retinol treatment, and sunscreen. So they sound really simple, which they are, but use one. I cannot live without this cleanser.
Oh, okay. Tell us about this.
It is, again, it's just something, you gotta smell it.
Okay.
And that's where, it actually smells better in the shower, but but it is one of those where
that smells good.
I know, I just, I don't necessarily, it's like brushing your teeth, where you have to get that mint.
Yeah.
So if I don't use this, then I just feel like, what have I got from the rest of the day that's not, or that's going to go on my pillow or my beds or, anything like that. And of course, there's so many different varieties. You can get specialized treatments for under eyes or whatever people see on themselves. But I would say that, and then I guess the second really thing that I love to do is micronutrients. The things that we're not getting in the food that we're from we kind of threw in the big food and everything. We're just not getting the essential nutrients.
Right.
And so, again, healing from the inside out and then protecting the out.
Yeah.
Those are the big things. And there's so many different mechanisms, like zinc alone. If you get a Botox treatment, it actually helps it stay longer. So then you're
that's good to
you're
know.
spending less money. And
Right.
it's just so many different ways that you can, you can live well.
Yeah, and this is the brand that you like, Thorn?
I love them. Yeah.
Okay.
I think they're more of a athletic sports. I think that's their derivative. But again, they're utilized. I love them.
Okay, Thorn.
Yes, Thorn.
And these are women's multi 50 plus. So are these good for anyone menopausing or?
Yeah, and even that perimenopause, I use it actually. I'm not 50 yet, but it's it's something where it was either a prenatal vitamin or a women's 50 plus, and I was like, well, that's kind of where I B12 and all those. But again, just the fun understanding the. Why am I putting this on? Is it just to, throw away money, or is it why am I? What is how it's helping or heal the dermis, the epidermis, and that's the fun part that I love.
That makes sense.
So again, Glowbiotics has so many different options. There's a nourishing gel, and so you put it on it and you feel nourished. Anything that has any sort of hyaluronic acid. That's a really hard word to say.
Hyaluronic acid?
Yes.
Okay.
Yeah. And that essentially pulls fluid towards it. And so when you put it in areas, so one really interesting thing, which I was like, oh my gosh, we've been deceived. We have different layers, obviously. Our bone, and then there's deep fat pads. And then we have some fascia, some muscle, and then superficial fat pads, and then our skin layer. So we start losing our deep fat pads in our late 20s.
R.I.P.
Do you feel cheated?
Yes.
When I learned that, I was like, oh my gosh. And most often the mid-face. And then we have, our temples. So that's why you'll see with each decade, you have what people say either sagging or sinking. And so it's not actually that you are getting, it's just that you don't have the support from those dynamic structures.
That makes sense.
Any longer.
So you're not gaining wrinkles, you're losing
integrity, you're losing collagen, you're losing, I know. So if you are getting dermal filler, which is another really cool thing, if you have somebody who doesn't necessarily know what you're treating and they inject on those superficial fat pads, those are the ones that are more mobile. And those are the ones where you get people who are like, gosh, it looks kind of fake, right? It doesn't look like it's supposed to be there.
Or it shifts.
It shifts throughout time. But they're not supposed to be injecting in that superficial pad. They're supposed to be going down to the bone to inject on that stable, that deep fat pad that we lose. And it just really helps support your skin, from there.
A lot of people might be performing it wrong and then giving injections a bad rap.
Yeah.
Oh, that must be frustrating.
I know. Well, and I think that's also to be honest, when I thought about it first, I was like, oh, Botox dermal filler, that's almost, like self-conceited or,
vain.
Yes, vain. And that was my perception, there's a stigma around a lot of things, including weight loss medicine and all these different things.
Yeah.
But, like when you break it down, what are you doing? Like that's when it's like, that makes sense in my mind on why you would do those different things.
So how do you address someone that might have those stigmas or those preconceived thoughts? Like what would you tell them? Like,
I think the best thing is, we look in the mirror at ourselves a lot, and we are our own worst critics, for sure. So there was a great thing I had heard recently where we weren't necessarily supposed to have all these mirrors. We weren't supposed to see our reflective selves. And we do all the time. And it's like it bombards us. And so when somebody comes to me, like my first question is, what do you see? Like what bothers you? Because I'm sure what you see doesn't bother your best friend over there. So what are you looking to, what's your goal?
Yeah.
And I don't have any like intention of doing out of the natural appearance. And so if somebody's like, I want like big lips, like duck lips, or I want, yes. If they're like, I want those, and my usual response is like, yeah, those would probably look great on you. I'd recommend you go to probably a different medical spa. There are some ones. I haven't gotten that yet. I imagine that I will at some point. It's just, that's not my goal for treatment. And I think that is one more so a boundary where, I try to guide them where they should be. It's not with me or my practice.
So you're focused more on like wellness and well-being and feeling good, not to be Pamela Anderson 2.0.
I know, and she looks great, I'm sure, but like you said, those lips.
Sometimes you see somebody, getting work done is a lot more common than it used to be like back in the 90s.
Yeah.
So when you see somebody with bad work, are you like, oh.
Yes.
And do you see it a lot?
Oh yeah, and I think you see it more so like in like magazine type things, where you kind of get that. Or social media. Yeah. Like where you're like, oh, she used to look like, I knew her in high school. And she did not look like that.
Yeah.
And so that's where, I think it's still, when you think of Botox or dermal fillers, that's what you think of as to be quite vain.
Okay, I gotta ask you something.
Yeah, go for it.
All right, what are your thoughts on Kylie Jenner's face?
So I'm not very good at like following those social media, but like the really high cheekbones.
And the lips.
And the lips, yeah.
Yeah.
Well, and she's probably going for like that overly, she didn't come here.
That's all we'll say. She
didn't come here. Well, and apparently just getting the attention that she wanted.
Yeah, that's true. It's, they look one way, like in their photos, right?
Right.
Beautiful, gorgeous. And then you see like a candid photo of it, it looks silly.
Right.
It looks silly.
Yeah.
Like, I think so many young women are comparing themselves to what they see on Instagram.
Mm-hmm.
But if you see, even with the BBLs,
right.
like, I love Cardi B, #1 Cardi B fan, right? Yeah. She looks silly.
Right.
Like, her ass is like...
They do butt injections. Did you know that? Yes. You can get, like, filler, you can get butt lifts. If you want it, you can get it. It's usually done in Los Angeles, but or Hollywood, or or the East Coast. But I was like, what would you do with a butt lift? Like better squats? I don't know.
I don't know.
Let Allie kill you more?
And it's like some, there are operations and everything that do look good.
Yes.
But it's like the over exaggerated.
Yes.
It's just. To each their own.
To each their own.
This is judgment-free zone, but Kylie Jenner did not come here.
Yes. No.
Okay, so in addition to you went through schooling, worked in the hospital, still work in the hospital, now you own this, you're a wife and a mom.
Yes.
So how do you juggle all of that? And what's some things that are like you enjoy doing in your free time?
That is a great question, and I think that was one of the biggest shifts from Reno to here, to home. Of course, so rewarding to be like, what did you do today? Like, I helped cure cancer, but, we operated until it was gone. Like, there wasn't like, I'll be home by 8, or I'll be home by 5 for dinner or whatever. There's multiple times when we were operating past midnight, and then you have to, go home and then around in the hospital by 6 or 7 a.m. So, I mean, there was no boundary on, like, how much sleep I could get or how much time you got with, like, the kids or whatever. So I do work part-time at the hospital, and I do work part-time here, and I do work full-time with my family. I coach my daughter's cheer, and that is, like, I love it. My son plays soccer, and so I try, we go to all the games and practices, and I think that's our generation thing, where it used to be your job was your, that's it, that's your identity, that's your full-time job. And now we have a bit more like part-time here, dabble in that, and I think the biggest thing from there to here was some boundaries with that, which again, it's kind of changing the expectation, too, where it's like I work at the hospital part-time, and I am here for you on those days 100%, and if I'm not there on that day, like my partner, collaborating physician, or somebody can also help you, but I can't see you there on Tuesdays, like
right.
Or whatever day it is.
And it wasn't always appropriate for women to have boundaries,
right.
for the longest time.
Yeah, absolutely.
Like we just had to be at people's beck and call 24/7.
Do it all.
Right, but now it's changing.
It is.
And then you said that you like to do your travel vlogs.
Yes.
Vlogs?
Yeah, they're blogs and vlogs, I guess.
Oh, cool.
So blog primarily, and I guess my big point on there is like any sort of like free education that I can provide on why are we doing this, and but the traveling. So in 2 weeks, we're going to Minnesota.
Oh, that'd be fun.
Yeah, so that's my 18th state.
Awesome.
And it's just a way to like see different places and taste the food. Like I cannot wait to go to like Louisiana and like the Cajun food and all these different places.
Yeah.
Georgia, chicken and waffles.
So good. That's what
But why would I was like, why would they put those two together? You eat the waffle or you eat the chicken, but they're really good.
Super good with the syrup.
Yes.
So
good.
It's delicious.
Yeah.
So if people wanted to see your travel blog and vlogs, where would they go to find it?
So that's called We Run the States.
Okay.
And actually they, that was another thing I noticed too, is that, everybody had kind of informed me, the better route would be to completely separate everything. This is All Orange, a med spa, and this is We Run the States. But that just felt like I was breaking myself off a lot. And if you're coming from weight management, like what do I want you to understand? Like what does exercise mean? What does diet mean? And so I did put them together, like within the same website. And again, I think that's probably my biggest critic is like you need to separate the two, but so they're both on We Run the States.
I think that's great.
Yeah, I thought it was a cool idea.
Yeah, I did the same thing with my business.
Good.
It's all like even my social media. It's just under my name because I'm my business.
Yes, it's so true.
Yeah, no, I totally. In all your businesses, which is like anytime I see somebody do this, I'm like, oh, she's a good businesswoman. Yeah. All your businesses complement each other.
Right.
All the work that you're doing.
Yeah.
So it makes sense to me. That's all under one page.
I know it should be.
I love it.
I guess it's sometimes hard to find what people say. So
that's all right though. They can figure it out.
Yeah.
I think do what feels good to you intuitively.
Right.
So I love that. So We Run the States is .com, right?
It is.
Okay.
Yeah,
WeRunTheStates.com.
Yep.
Okay, and I'll put that in the description. And then to make an appointment at your med spa, how do people do that? Same place?
Same place. Yeah, you can either do that on the website. Again, we're so small. Like you can call me. Either here, I'd say you could stop by, but it is by appointment only, so I don't kind of just hang out here and...
Yeah, she's got things to do, okay?
Yeah.
She has her PhD, she's busy.
She's got some things to do, so...
Yeah.
Cook dinner, or laundry. Or kind of the top of the list.
Almost every day. It's like,
I know! And then you finally, get some things done, and it's like, there's another basket.
Mm-hmm. It's never ending.
Never.
And I used to beat myself up about it, like, oh God, there's laundry again, I'm a failure. But I'm like, there's always gonna be laundry.
Always.
Always gonna, especially
and
with
the
kids.
Dishes.
Yes, laundry and dishes. It's the vein of my existence.
I know.
But what can you do?
Mm.
And any advice for women that are starting about getting into this path or maybe want to learn more about this path or learn more about business, what advice would you give them?
I think just like what you had mentioned, like do what you love, because there will be so many times when you're like, why am I doing this? Like, when you talk about it or anything, like the blog doesn't make money at all, or it's everything's in the red. So you are spending this on your hobby, what you enjoy doing, and so just know that going into it. We're not here to make it big or anything like that. We're doing it because I enjoy doing this, and so that constant, what is it? Remember your why.
Oh, I like that.
Yeah.
Remember your why. Anything else that?
Oh, thank you. This is really fun.
Thank you. She is a wealth of knowledge. Her spa is beautiful. I'm going to link all the details. And make sure that you subscribe to the channel to help support so we can keep getting interviews from other girlies.
Yeah.
Thank you. Thank you very much.
Cheers.
Can you do me a favor?
Yeah.
Okay, my cousin's name is Amanda. Would you mind just saying a little a encouragement, a word of encouragement to Amanda?
Well, Amanda, I'm so excited for you. Just know you have so many options. And that's the best part of this healthcare world, is that we can help people in any way. And if you don't feel like you're getting the help back, divert, go to another pathway. Even within the, you don't have to quit. You could just take another road.
That's such good advice. That's good to be teary-eyed.